I fell in the bathroom. I have a walk-in closet in my bathroom.
I fell at his school walking down to the end of the walkway, and it was a mighty jolt.
When a senior person falls, it becomes a trauma activation.
Unfortunately, once a fall does occur, it kind of sets that person up for additional falls.
But there are things that may help you prevent falls in the first place.
Yeah, it was scary, it was painful.
But giving up is not an option.
Atrophy can set in with laying in bed for just 24 hours.
Once you've fallen, that may be the end of your ability to live independently.
No, I'm not going to give up. No. I'm not going to. I'm going to continue.
Retirement in San Diego County. You plan a little golf, a little gardening, a lot of R&R. What you don't plan for is this.
I just tripped and couldn't catch myself, and I fell on my left hip. And I knew immediately that something was broken.
I fell into my china cabinet once. I fell 3 times right on the floor.
Falling. What's funny in an old slapstick routine is not in real life. Falling can be deadly, especially as we age. Falls lead to broken arms, broken hips, even head trauma. It's scary. Nobody wants to be dependent on others, no matter how old you are. Hi, I'm Michael Russo with the County Television Network. As a senior, when you fall, you run that risk. If your fall is bad enough to require hospitalization, there's a 40% chance of being dependent on others for the rest of your life.
Once you fall, particularly if you break something, there's a good chance you won't live independently again, that you'll need to have a skilled nursing facility or an assisted living facility. If you survive, remember, many of the folks who fall end up dying from the complications of their fall.
And the statistics are mind-boggling. 40% of seniors in this county will have a fall in the next 12 months. That's more than 100,000 people. 80,000 will fall a second time within 6 months. Over 65, falls are the leading cause of death resulting from injury. And statewide, 2 seniors in California die from fall-related injuries every single day.
The more proactive folks can be in preventing a fall, and about 40% of falls that happen are preventable, then the longer they'll be able to stay at home in a healthy and safe way.
To prevent a fall, you've got to know what can actually cause a fall. Well, sure, there are the obvious things like tripping over something or falling off a ladder, but there are other not so obvious things that can increase your risk. Medication, balance and inner ear problems, lack of exercise, improper nutrition, even fear of falling can make you fall.
Sometimes the more you think about something, you start to obsess about how afraid you are because your friend next door fell and never came home again, or your best friend took a fall in the bathtub. This fear of falling can actually create an additional risk.
So can your medication. How? Take it incorrectly or not at all, or combine it with other medications, and it can be a major risk.
Pain medications slow you down, anti-allergy medications slow you down.
And people like Harminder Sikand ought to know. A pharmacist for 14 years, she sees a lot of seniors who make a lot of mistakes.
If you're having problems remembering things, we recommend you have the physician's office or the pharmacist write down your medication or type it down so that you can carry it with you. And you can use the same medication list to perhaps using a pill box fill your medications for the week. So you don't have to remember, do I take Coumadin in the morning? Do I take it twice a day? It's in your pill box.
The older we get, the more intense not only the side effects are from medications, but the more they affect our body, both mentally and physically.
In other words, that cold medicine you took when you were 40 may have been fine. Take that same pill when you're 70 or 80 and you could be out all day, or possibly very fatigued. Also, be careful with herbal medications. No prescription means no FDA oversight. Sometimes the herbal might be fine, but combined with 1 or 2 of your other medications, it can cause big problems.
Many of the herbal medications have same effects as prescription medications, and so you can actually increase the effect of the medication you're taking.
If you're not taking adequate water intake and you're taking multiple medications, then your body isn't metabolizing those medications appropriately and can actually make you more dizzy, or can increase or decrease your blood pressure faster or slower. So you need to drink at least 8 to 10 8-ounce glasses of water a day.
A lot of times how they are metabolizing drugs and how their kidneys are functioning is a function of hydration, and so the lab values in these patients can be concentrated because they have less volume in the body.
The best advice regarding medications: follow your doctor's directions. Know the warnings. Write down every medication you take, including non-prescription medication, and when you're supposed to take it. It'll help not only you, but those helping you.
It's important that you know that you're your best advocate, or your caregiver is your best advocate, because if you're on a lot of medications and you're seeing quite a few physicians, specialists and internists, and you're getting your medications filled with different pharmacies, we don't exactly know what you're taking, how often you're taking it, and who you're seeing. So it is important every time you go to a pharmacy, a physician, a surgeon, a dentist, an optometrist, any sort of healthcare provider, you take your list of medications with you.
And I had the surgery and the lung removed. And I've been adapting, you know, to that and living on oxygen. And my husband, I have a little scooter so I can get around, and if not, I use a wheelchair. But I've been getting around really well.
Hold. Good.
Next is balance. Balance and the inner ear go hand in hand. Just ask Marion Rasko of North Park.
I opened my eyes to look at the clock, and the whole room was spinning.
That was 2 months ago, the last thing this semi-retired real estate agent wanted to have happen just a few months after lung cancer surgery. Now Rasko, who's 77, is in physical therapy.
We typically see patients after they've fallen or after they've visited their doctor, and the doctor diagnoses whether they have an inner ear or balance disorder.
And what happens if you have a slumped posture or a slouched posture?
Balance is a huge component of what a physical therapist can touch upon. Balance is something that affects all of us, despite what age we're at or maybe what's medically going on with us.
The thing we see time and time again is folks who've had problems with their balance, who haven't gotten help, who haven't learned how to steady themselves, who fall. And the important thing to remember is if you see your doctor and talk about those balance problems, you can learn how to keep your balance, you can learn how to walk safely.
If not, you could slow down even more, or just not get any exercise, and that's bad, because no physical activity is just an all-around no-no. Muscles can atrophy quickly, sapping strength, making your fall risk much higher. In other words, you gotta move.
If you're not moving, the circulation is not occurring. The heart and lungs need to be able to provide the brain and the muscles with the nutrients that they need in order to do your activities of daily living.
Okay, Marion, go ahead. I want you to hold up the card right in front of you. There you go. As part of your gaze stabilization exercises, your eye exercises, you're going to go ahead and stare at the card.
Yes.
And I want you to keep it in focus while you bring your head back and forth like you're saying no.
For Marion Rasko, she doesn't plan to sit around.
Don't accept the status quo. Because if you're exercising and your systems are getting exercised the right way, just because you're getting older doesn't mean your balance should decline.